it can be a stressful decision for parents. And as I mentioned, yeah, feeding your baby new foods that commonly cause an allergic reaction, that can be hard for parents when they have to make that decision. But the guidelines coming from the American Academy of Pediatrics says the earlier the better, and even babies with a relative with an allergy should still try foods like peanuts when solids are started.
You guys ready to go get some lunch?
2.5-year-old Livia ahead of the curve.
You like nuts? Do you like eggs? Yes.
Her mom Laura fed her peanuts and eggs when she started eating solid foods.
Trying to get her exposed to, I think, as much as possible at an early age to see if there were any issues.
And that's what the American Academy of Pediatrics is now recommending, a change from guidelines a decade ago. You can feed your baby infant-safe forms of peanuts at 4 to 6 months of age. An early introduction reduces the risk of an allergy. Dr. Purvi Parikh, an allergist with NYU, says there are only 2 exclusions to this.
The child already has an egg allergy or the child has severe eczema. Then they need to see a board-certified allergist first to make sure it's safe to proceed.
If you're worried about an allergic reaction, doctors say look out for vomiting, a rash, trouble breathing, and sleepiness. Immediately stop feeding the baby and call 911.
I just made sure I did it during a weekday when the doctor's office was open.
JACLYN MOMMEN says she waited to give her son Asher peanut butter until he was between 9 months and a year.
I tried to actually introduce peanuts to my son earlier by just eating it myself and then being close to him.
The old guidelines had people introducing highly allergic foods after 12 months. Dr. Parikh says using a dropper like this is a good way to feed peanuts to a baby.
You can crush peanuts or something into a very fine powder or a paste. And then if that is still too thick, then we recommend mixing it with breast milk, formula, water to then make the consistency even thinner and safe for the child to swallow.
So you heard the doctor mention about babies with risk factors like eczema and an egg allergy. So those babies, they sometimes can still be exposed to peanuts, but in a clinical setting with a doctor's supervision. Live in the newsroom, Allison Caden, Pix 11 News.